Dr. Amit Thakker from Nairobi, Kenya. He is the chairman of the Africa Healthcare Federation. Good to have you with us on the programme. So what particular challenges does Africa face when it comes to tackling coronavirus?
Look, I think we are facing the challenge because we needed to ease the restrictions, number one. And the second thing is that we are also seeing ease of the health protocols. So those are the two big challenges we are facing. We had an early lockdown compared to many other continents across the world in March and April. We have eased the lockdowns because we needed to resume economic activities. And we are seeing the second peak because of that. And the issue of social distancing and mask is a matter of messaging and ensuring that the communities continue to follow the health protocols. So these are the two reasons I think those are the challenges that we are currently facing.
And what lessons, if any, were learned from tackling the Ebola crisis, and how are they helping the current response?
So I think we were really advantaged because during the Ebola crisis, we understood infection prevention control. And so the lessons learned, while we need appropriate infrastructure across all the countries in cities and suburban areas. So those lessons are being learned. As we speak now, many countries are preparing and are building the right infrastructure for infection prevention control for those who are sick and need to be treated. And also, when we do have casualties or we have mortalities, on how to safely handle the dead to avoid those becoming focus areas to spread the virus even further. So, plenty of lessons learned, giving us the advantage of keeping the numbers down.
And we mentioned the resurgence of yellow fever in Nigeria. Is there a danger that other health issues, such as yellow fever, faced in Africa might be being ignored while the focus is on COVID-19?
Absolutely. And the zoonotic disease that we all know of, such as Rift Valley fever, yellow fever, like you mentioned, or Marburg virus, this is the health disease burden that needs to be refocused on. So it is on top of the mind of the ministers of health and health leaders not to ignore the essential health services to avoid such mortalities to take over. So indeed, that's a real top of the mind issue right now.
OK, Dr. Amit Thakker, thanks very much indeed for joining us on the News Hour today. Thank you.